Human Papilloma Virus, and it is a virus that is spread through contact. So it is not necessarily sexual contact. You can be protected with a condom and still can get HPV, because it can be on the skin, it can be on the genital area, and then when the person comes in contact with it, you can get it. And there are so many strains of HPV. There are different types, but there are some specific ones that would lead to cancer. So, and there are no like specific symptoms, except the ones that lead to cancer can cause warts, genital warts. So that's the only way you can see that you have HPV. But if it doesn't come, and it depends on the person, depends on different people also. So if it doesn't form the warts, then there's no way to know exactly that you have HPV, which is why it is very difficult, because it can continue and lead to cancer, cervical cancer or vulvar cancer, vaginal cancer, and you might not know that you had HPV, and it will just continue and progress onto cancer. So the only sure way to know is to go for regular pap smears, and then check. If they do the pap smear and then they find some abnormal cells, abnormal cervical cells, abnormal growth, then they will now know that, okay, we have to prevent this from turning into cancer proper, or treat the precancerous conditions. So that's for HPV. And then the ways to protect ourselves will be to use condoms normally. And then vaccination. Yeah, you can vaccinate, they can vaccinate, but for the vaccination, when people are already sexually active, there's no point in doing the vaccination. So it has to start from when the young girls are from like 11 to 12 years old, 11 to 12 years up to about 26 years. That's the only time that is really acceptable for vaccination. After 30 years, it is not as effective as when the person is younger for the vaccination. So maybe I'll take one question that someone asked. The question is, I would like to ask about contraceptives, how they work, especially pills, and how